Lots of patients wonder about the experience on the day of surgery. So in our surgery center, one of the things that we are very lucky to have is our own private ambulatory surgery center. Fully licensed, accredited, so all the things that you would find in a hospital, but in a very private environment, almost like a boutique hotel. A lot of the patients are surprised when they walk in that they're the only patient there. That means the entire staff has one mission, and that's them. They're not part of, a herd of patients coming in for surgery like you would sometimes see in hospital or busy outpatient surgery centers. And that's, I think, one of the things that really gives the patient a lot of comfort. So we have some time before the surgery, during the surgery, and after the surgery. So patients generally arrive about an hour to an hour and a half before the surgical time. So they can come in, they can see the facility, they can change, and they can kind of get comfortable in their room. We have licensed RNs with a lot of surgery center experience that are usually there. They make the experience very nice, make the patient feel comfortable. Even the one thing that people dread, that's the IV start, is done in a very safe and comfortable manner. You're hooked up to monitors and get the nurses ask a lot of questions to get the patients ready for surgery. It's also a time to meet the anesthesiologist. Most of the patients have met me. They get to meet the other MD in the room. We only use board-certified MD anesthesiologists just to maintain a very high level of care. So when patients come in, they have 2 MDs, 2 RNs, and 2 scrub techs. Focused only on them. And again, it's one of the things that we're proud of in our ambulatory surgery center. People get medicine to relax them, and they're generally very calm and relaxed by the time they go into the operating room. Once they enter the operating room, it's usually an interesting place. There's lots of monitors, there's machines, there's certainly a lot of people that are there to take care of the patient. And so we are very focused on making sure that transition is comfortable. Patients are giving a nice warm blanket, they're laid on a nice comfortable bed, and the anesthesiologist will generally do an excellent job at getting the patient prepared for anesthetic. Usually we have fun, we have a countdown, and people start 10, 9, 8, 7, and generally they say 6 when they're in the recovery room. So it's a very quick sort of thing, and they don't realize that between 7 and 6, we got a whole procedure done for them. When they wake up out of anesthetic, a little groggy, but the anesthetic we use, allows people to emerge very quickly and very easily. Nice soft landing, after a nice plane flight. The anesthesiologist is there, we have RNs again, and of course, I come and check on the patient to make sure they're doing well. Obviously, there's surgery, there may be some pain, but we have excellent pain relief both through the IV line and also oral medication. As well, there's actually not a lot of pain because of surgical technique. When I operate on a nose, we respect, without getting too technical, tissue planes. We're not rough housing in there. We're very smooth and very technical on how we do things. And that results in very minimal tissue damage and therefore less swelling and less bruising and less pain.